All right, so we have some more practice HESI questions. So again, as always, you can either answer in the chat or you can answer out loud, whichever is easier for you. And I will share my screen. Oops, maybe. Come on, please work with me here. All right. So the question, all right, as always, make sure you read it carefully. You identify the subject of the question, pick out those key words, and what is the question really asking you? All right. When we're looking at multiple choice questions, read each question, or I'm sorry, you want to read each question carefully, but you also want to read each answer carefully. Remember that only one answer is the correct answer. What is the desired outcome for your client? Think health, think safety. Know what your scope of practice is, right? Especially with those delegation and assigning questions, know your scope of practice. Priority questions. All answers may be right, but only one is the best answer. So think if you can only do one of those options, which is going to be the safest, which is going to be the best for your client. All right, here we go. So, first client, a patient with type 1 diabetes reports feeling dizzy. What should the nurse do first? Check the patient's blood pressure, give the patient some orange juice, give them their morning dose of insulin, or use a glucometer to check the patient's glucose level. If we have a type 1 diabetic feeling dizzy, what should we do first?
4.
All right. A couple more people need to answer.
I'll say 4.
Yes.
All right.
For first.
Very good. So question here, type 1 diabetes, feeling dizzy. What do I do first? Absolutely. You're going to check the patient's glucose level, right? We want to know what that glucose level is, especially knowing that they are a diabetic. So before we give any juice or insulin, always check that. Good job. All right. As the shift begins, the nurse is assigned to care for the following patients. Which patient should the nurse assess first? So we have a 38-year-old patient with Graves' disease and a heart rate of 94 beats per minute. We have a 63-year-old patient with type 2 diabetes and a finger stick glucose of 137 milligrams per deciliter. We have a 58-year-old patient with hypothyroidism and a heart rate of 48 beats per minute. Or a 49-year-old patient with Cushing's disease and dependent edema rated as +1. Who are we going to assess first?
3.
I would say 3.
3. Yeah, 3.
Very good. A 58-year-old patient with hypothyroid and a heart rate of 48 beats per minute. Although patients with hypothyroid often have cardiac problems that include bradycardia, a heart rate of 48 beats per minute may have significant implications for cardiac output and hemodynamic stability.
Can I ask a question before we move on? I'm sorry.
You sure can.
Okay, I want to see because I've been studying different ways to answer questions, and I got answer 3, but this is how I got to it. I looked at all of them right, and I looked first and seen that all of them were chronic. They were all like chronic conditions. Okay, so I eliminated that. We couldn't use that. And then I went back to it, and nobody was like post-acute surgery or thing. But finally, I got to it of the organs of the body, and it was for the respiratory rate. The heart rate was 48, so that's what made that more significant. Is that right?
Mm-hmm.
Okay.
Yes,
Thank
ma'am.
you.
Absolutely. Yes. So what is normal pulse rate? What's our normal heart rate?
60 to 100.
Okay, 60 to 100. Okay. 48 is pretty low, right? Even
Mhm.
even for somebody with, with hypothyroid, 48 is pretty low. And so, yes, we know with hypothyroid, they could have a low pulse rate. But something that low, like it says here, we worry, right? Cardiac output, we worry about perfusion, right? Are we getting enough blood to the fingers, the toes, right? The organs. So, you're absolutely correct in your thinking. That was very good. Okay, so this one, which patient should the charge nurse assign to the care of an LPN under the supervision of the RN team leader? So we have a 51-year-old patient who has just undergone a bilateral adrenalectomy. We have an 83-year-old patient with type 2 diabetes and COPD. We have a 38-year-old patient with myocardial infarction preparing to discharge. Or we have a 72-year-old patient with mental status changes admitted from a long-term care facility. So, using that thought process, which one are we going to assign to the LPN?
I would say number 2.
Okay.
I think two too.
I'm just looking at the chat too. All right. Ta-da. Absolutely. Okay. The 83-year-old, there's no complicating factors at the moment. They're stable, right, and uncomplicated. A 51-year-old who just underwent a bilateral adrenalectomy, they're post-op, right? They're going to require assessments, higher level of care. 38-year-old patient with an MI preparing for discharge, right? The RN is going to be the one that needs to go in there and do that discharge teaching with them. And then the 72-year-old with mental status changes admitted from a long-term care facility, right? They're going to need that admissions assessment, so needs the RN to go in there. Good job. All right. The AP is delegated the task of measuring morning vital signs for all patients, all 6 patients. Why there's only 4, but which finding would the nurse instruct the AP to report immediately? An oral temp higher than 102, a blood pressure higher than 140 over 80, a heart rate lower than 65, or a respiratory rate lower than 18. Which one of those do we want the AP to come back and report to us like immediately?
One. One.
All right. Absolutely, right? That temperature to 102 is an indicator of an infectious process. All the rest of these really are kind of right there at the normal, right? So, if this is but this is going to be our highest priority. All right. The nurse is caring for a client with varicella and advised the UAP to take which precautions when caring for the client. So, mask and gown, gown and gloves, mask and gloves, or gown, gloves, and mask.
4.
All right, so we got a variety answers coming through. So let's start with, what is varicella?
Airborne.
I'm sorry,
Chicken pox
Airborne.
chicken pox.
Chickenpox.
And how is chicken pox spread?
by touch. Is it
And
Airborne.
Touch. Airborne.
very good.
always airborne?
It
Okay.
is both airborne and contact.
Contact.
Okay. So somebody that has varicella, we are going to put them on both airborne and contact precautions. So you're both right. So Katrina, you're absolutely correct. It can be spread by touch, right? We look at chickenpox, they get those little vesicles, right? And the little fluid in those vesicles is highly contagious, okay? Just like when someone has chicken pox, they can self-inoculate, right? They scratch those areas, they can spread the chicken pox. So the correct answer here is going to be gowns, gloves, and mask. Mask is going to cover us for the respiratory, and then the gowns and the gloves is going to cover us for the contact precautions. Well, gloves will cover us too, but so we want to put them again on airborne and contact precautions until those lesions are dry and scabbed. Once all the little vesicles pop and those little areas crust over, they are not contagious anymore.
Oh,
All right. The nurse prepares a plan of care for a client receiving a chemotherapy treatment with IV bleomycin sulfate. The nurse would document which priority intervention in the plan. So, monitor for dyspnea, monitor for alopecia, monitor for anorexia, or monitor for a change in bowel patterns.
I would say monitor for dyspnea.
Okay. Okay. I like the honest answers are always great. So, bleomycin is a um it's a chemo drug, okay? But one of the biggest things that we worry about with um bleomycin is that it has the potential to cause pulmonary toxicity. Okay, so that we are going to monitor for that shortness of breath. So again, it is a chemo drug. It's an anti-neoplastic. It can cause interstitial pneumonitis that can progress to pulmonary fibrosis. It is not reversible. Okay, so um, that's probably one of the biggest issues with this one. So we're going to monitor their for shortness of breath. We're also going to listen to their lung sounds. That would indicate any of that pulmonary toxicity that could be occurring. All right, a child, sorry, with a diagnosis of pertussis or whooping cough is being admitted to the pediatric unit. As soon as the child arrives on the unit, which action would the nurse perform first? Okay, so kids admitted with pertussis coming up to the unit, what are we going to do first? Weigh the child, take the temperature, place on a pulse ox, or administer prescribed antibiotic.
8.
That's 4.
I think it's 3.
All right. So 3 is correct. So pertussis is also respiratory, right? It is highly contagious bacterial infection of the lungs. Okay. Absolutely. But the first thing that we want to do is put them on the pulse ox so that we can make sure that they are getting enough oxygen. And then, right, then we will probably start the antibiotics and, do all the wonderful stuff from there. Okay. But the first one, remember ABCs, airway, breathing, circulation. All right. The RN is making assignments for the shift on a med surg unit. Which client is most appropriate for the RN to assign to the LPN? So we have a client admitted 1 hour ago with acute pancreatitis requiring a full admission assessment. We have a client that is 2 days post myocardial infarction who reports new onset chest pain. We have a client with a stable colostomy who requires routine irrigation and care. Or we have a client newly diagnosed with heart failure who requires discharge teaching. So which one is most appropriate for our LPN?
C.
All right. Yes, absolutely. A client with a stable colostomy who requires routine irrigation and care, right? LPNs care for stable clients with predictable outcomes and can perform routine procedures, right? This client admitted 1 hour ago needs that full admission assessment. This one he had a heart attack 2 days ago. Now he has new chest pain, and then a newly diagnosed with heart failure who requires discharge teaching. Those all need to be seen by the RN. Very good. All right. The LPN is assigned 4 clients and is supervising a UAP. Which task is most appropriate for the LPN to delegate to the UAP? Perform blood glucose monitoring for a client with diabetes, assist a stable client recovering from pneumonia with a bed bath, assess a client reporting new abdominal pain, or administer oral medications to a client with hypertension. So
B.
which one?
B.
B.
Very good. Definitely can do, right? That bed bath. All right. Now we're going to do select all that applies. Okay. Everybody loves these, right?
Mm.
So, best advice for select all that apply. Look at each answer choice independently and turn the question into a true or false type question. So, when you're looking at the answers, tell yourself, is this true or is it false? Okay. And that's how you make your determination. It's not multiple choice. There can be several correct answers. Big thing with these two, and I'll tell you, I struggled this, and I remember these questions when I was in school, and I struggled with them a lot. Don't focus on how many answers that you choose, okay? You need to select at least one, okay, unless the question tells you the number to select. So you may see questions that'll say select 3, select 2, select 4. Okay, in those cases, you want to make sure that you select the correct number, right? But just, don't focus on that. That was always my thing when I was in school. I'm like, how could I just pick one? Or I picked all of them. Now what do I do? Like, that can't be right. And then I started second guessing myself. Don't do that. Okay. Just go do, work each one through as a true and false question and pick the ones that you think are correct. And then look at the outcomes of the answer you selected, meaning, if I do this for my patient, what is the outcome going to be? All right, here we go. All right. The LPN is supervising a UAP while caring for several clients on a med surge unit. Which tasks are appropriate for the LPN to delegate to the UAP? Select all that apply. So, assist a stable client with bathing, measure and record intake and output, assess a client complaining of chest pain, ambulate a stable postoperative client for the second time that day, reinforce teaching about wound care, or obtain routine vital signs on a stable client.
A, B, F,
Okay.
D.
All right.
A, B, D, F.
All right.
Mhm.
So got a lot of A, B, Fs. All right. So let's work through this one together. Can a UAP assist a stable client with bathing?
Yes.
Okay. Can they measure and record INO?
Yes.
Okay. Can they assess a client complaining of chest pain?
No.
No.
Okay. Can they ambulate a stable post-op client for the second time that day?
Yes.
Okay. Can they reinforce teaching about wound care?
No.
No.
All right. Can they obtain routine vital signs?
Yes.
Yes.
Okay. Perfect. Absolutely correct. So I know some were stumbling on this one right here. Okay. So the key here, there's two. One is stable, right? The client is stable. The second one is it's the second time that day. All right. So if this had said ambulate a post-op client for the first time, that would have been a no, right? Because too much can happen, right? We want the nurse there to do that. So this is the key. It was stable and it was the second time that day. All right. The LPN is preparing to reinforce teaching to a patient with a new diagnosis of osteoporosis about strategies to prevent falls. Which teaching points should the nurse be sure to include? Select all that apply. Wear a hip protector when ambulating. Remove throw rugs and other obstacles at home. Exercise to help build your strength. Expect a few bumps and bruises when you go home. Rest when you are tired. And avoid consuming 3 or more alcoholic drinks per day.
Two, 5, 6.
2, 5,
Two,
and 6.
two, three,
1,
five,
2,
and
5,
six.
6. 1, 2, 3, 5, 6. All right, we got some kind of all over the place, which is fine. So I'm going to stop sharing for a second and I'm going to show you guys a picture. Okay. Um, oh, wrong one. Okay. These are hip protectors. Okay. And they look like football pads. And I'm not going to lie, I played soccer my whole life up until my early 30s. Okay. And I had shorts that were similar to these because I was a goalie. Okay. So they were a little bit longer and they covered a little bit more of my thigh, but I wore them and I was proud of them. But these are hip protectors. Okay. And so they come in a variety. They come in like an underwear type style, or they come in like a belt style where they can put them on like the outside of their clothes if they wanted to. They also come a little bit more intensive looking. Um, but here you can see where the pads sit. They sit right over those hip joints. All right, so if they were to fall, it provides a little bit of extra padding. Some of them, and I was trying to find it, some of them, here we go, also offer some additional padding on the butt, okay, for that coccyx and sacral area. So, think about it. They have osteoporosis, right? They're very prone to fractures. So falling on the hips, they can break a hip, but if they fall on that butt, right, they can break their coccyx as well. All right. So we want to make sure that we are, protecting them. So I kind of wanted to show you what those look like so that you didn't think I was crazy if I tried to describe them. Just saying, because, people think I'm crazy sometimes. All right, so the correct answers. All right, oh, I lost y'all. There you guys go. All right, so yes, wear a hip protector when ambulating, remove throw rugs and other obstacles, exercise, and rest when you are tired. Okay, expect a few bumps and bruises at home. No, the whole goal here, right, is so that they don't fall. We don't want them to have bumps and bruises. And women should not consume more than 1 drink per day. Men should not consume more than 2 drinks per day. Okay, so we don't want to say avoid 3 or more. Okay, we want to give them that accurate information. All right. The LPN is caring for 4 clients and working with a UAP. Which client care activities should the LPN complete rather than delegate to the UAP? So, administer an oral pain medication. Should the feed a stable client who has no swallowing difficulties. Evaluate a client's response to pain medication. Reposition a stable client every 2 hours, or reinforce discharge instructions for a client with hypertension. Which of those should the LPN do, not the UAP?
A, C, and E.
E and E.
All right. Absolutely, right? So the LPN is going to give the medication, they're going to evaluate the response, and they can reinforce discharge teaching. Okay. The UAP can feed a stable client without swallowing difficulties and reposition a client, right, every 2 hours. All right. Excuse me. All right. The charge nurse assigns the nursing care of a patient who has just returned from open carpal tunnel release surgery to an experienced LPN. Which instructions would the RN provide for the LPN? So this one says to select three. So one, check the patient's vital signs every 15 minutes for the first hour. Two, check the dressing for drainage and tightness. Three, elevate the patient's hand above the heart. Four, the patient will no longer need pain medication. Or five, instruct the patient to perform range of motion on the affected wrist. Okay, so which of these should we give to an experienced LPN?
1, 2, and 3.
One, two, and three. Okay. Everybody know what carpal tunnel is?
Yes.
Okay. All right. Oops. There we go. All right. So, yes, check they just come out of surgery, right? Post-op care. We're going to check the vital signs every 15 minutes in the first hour. They're going to check the dressing for drainage and tightness. And we want to elevate the patient's hand above the heart. They are going to need pain medication. I don't know about y'all, but that's a very sensitive area. Okay. And they just had surgery. So they're going to need pain medicine with range of motion. So with open, okay, with open carpal tunnel, they're probably going to have restricted movements, probably about 4 to 6 weeks after surgery. And so again, the incision, if it's open, is going to be a little bit longer than if we were doing, the whole. Oh my gosh, I've only been a nurse for how long and I can't
Patient.
remember. Thank you. I don't know why I was like it just went out of my head. So yes. Oh my goodness. All right. A preschool client has a diagnosis of glomerulonephritis. Okay. Which symptoms would the nurse expect for this client related to the diagnosis? Select all that apply. Sore throat, abdominal rash, serum creatinine, and periorbital edema.
2, 3, and 5.
I think you gave us the answers.
I gave you the answers?
You said sore throat, abdominal rash, or unless I'm in periorbital edema. Never mind. I'm sorry. Never
I
mind.
read all of them.
I'm sorry.
I would say
I was like, I did. I mean,
3,
technically, I read all the answers.
3. The creatinine value, the periorbital edema for sure, because it's in the glomerular, so it's no filtrating, so it will retain fluid.
hmm What do you think, Lilani?
What?
What do you think? All right.
I
So we
think
got a bunch of different answers here. Um, so let's start with what is glomerulonephritis?
It's an inflammation on the glomerule of the kidney.
It's an inflammation of the glomerulus, okay?
Mm-hmm.
What causes glomerulonephritis?
Strep
Recent
throat.
strep infection.
Okay, a recent, so that's the key word, right?
Mm-hmm.
It's a recent, oh my gosh, a recent strep infection, okay, most of the
Okay.
time. Okay, so glomerulonephritis occurs, it doesn't occur at the same time as a strep infection. So that is something that's important to understand, okay? So we have an inflammation down at that glomeruli, okay? That's where all the filtering takes place, okay? So we often have difficulty, right? Um, filtering the blood. All right. So, sore throat and an abdominal rash would be indicative of what? That's strep infection, right? But this
Mm-hmm.
is occurring 2 to 3 weeks afterwards. Okay. So, the sore throat and the abdominal rash would be gone at this point, right? So, they'll have weight gain, their creatinine will be elevated, and they'll have periorbital edema. Okay, so why does the swelling occur?
Because fluid is not being filtered or
Okay.
waste or something like that.
Okay, it's because the fluid isn't being filtered. Okay, so again, just like I said, right, we have the inflammation down at that glomerulus. The glomerulus, I hate that word. Sorry,
The
the
kidneys are
glomeruli.
impaired.
Yep. And so we're not filtering, they're not able to balance the fluids like they should, which causes excess salt and water to build up, okay, in the body, which is going to lead to that swelling. Additionally, all right, we also will have some protein that will leak into the
Mm.
urine. And if you remember albumin's that biggest protein that we have, right? And if protein is leaking out into the urine, then we don't have the protein in our blood to maintain that oncotic pressure, which is going to then allow more fluid to leak out into the surrounding tissue. So that is how they have the periorbital edema and the weight gain, right? Because we know weight gain is from the fluid retention. How much does a liter of fluid weigh?
A little 1,000 ml.
So a liter is 1,000 mLs. How much does that weigh? If I were to put it on a scale, how much does it weigh?
Oh, you asked us question before.
Is it more than 2 pounds?
1.2.
Yep, 2.2 pounds or one
Okay.
kilogram, right? And we know that weight is a huge indication of fluid status, right? So that's why we do those daily weights. All right, good job, good job, good job. Okay. All right. The nurse is caring for a client with diabetes insipidus. The nurse is likely to observe which findings during assessment, select all that apply. So we have a heart rate of 110 beats per minute. We have a blood pressure of 165 over 97. We have a respiratory rate of 28 breaths per minute, distended neck veins when supine, and a tongue that displays a deep furrow.
I would say 2, 4, and 5.
2, 4, and 5. Okay.
I would say 1, 3, and 5.
1, 3, and 5.
Yeah, I'd say 1, 3. I know about the tachycardia, but I think the blood pressure is low in diabetes insipidus.
Okay. We've got a lot of 1, 3, and 5s, a lot of 1 and 5s.
I didn't look at the diabetes.
So what happens with diabetes insipidus?
Dry
Too
inside.
much urine.
Yeah.
Urine a lot.
So we have excessive urination and increased thirst, right? But even with the increased thirst and the excessive amount of urination, we are still going to become dehydrated. Okay. So, signs of dehydration, or think shock. Okay. Um, Hypovolemic shock, right? Low blood pressure, high pulse. Anytime you see somebody that has a low blood pressure and an increased pulse, it is some sort of shock, okay? Other than neurogenic shock, okay? Neurogenic shock is the only difference. Usually they'll both go one way. They usually both will drop, okay? But if you see a high heart rate, low blood pressure, high respiratory rate, something is going on. And yes, the deep furrows, they come with dry mucous membrane. So like, have you ever been like really thirsty or had like just like really bad dry mouth and your tongue starts to feel like it starts to hurt because it's so dry? I don't know if anybody has ever experienced that. Um, but when it's like starts to look like a shriveled raisin, okay? And so you can start getting some deep lines just because of that dehydration. Now, if the tongue were, this is one of the reasons why we try to keep that mouth nice and moist, because if the tongue gets really, really dry, it can start to crack, and then that opens up the mouth for infection, right? And the tongue is very vascular, so any bacteria, viruses, they have a direct route to the heart, right? So we want to be really careful. All right. Which interventions would the LPN delegate to an experienced assistive personnel? Select all that apply. So, one, changing the patient's incontinence pad as needed. Two, performing pulse ox every shift. Three, teach the patient to cough and deep breathe. Four, reminding the patient to use incentive spirometry every hour while awake. Five, assessing the patient's breath sounds every shift. Or six, encouraging the patient to drink adequate oral fluids. Which of those can the UAP perform or do?
1,
2, 6.
2.
4, and 6.
1, 2, 4, and 6.
Mm.
One, two, 4, and 6. Very good. Yes, absolutely can change the incontinence pads, no problem. They can do pulse ox every shift. They can remind the patient to use their incentive spirometer, absolutely. And they can encourage them to drink fluids as well. So, yes, good job. Absolutely. All right, which patient should the team leader assign to the LPN for nursing care? So we have Mr. C, who has stable angina. We have Mrs. J, who is having chest pain. We have Mrs. S or Miss S with heart disease and dementia. We have Mr. B with new onset decreased urine output and altered level of consciousness. And we have Mr. L with shortness of breath and chronic emphysema.
1, 3,
1, 3, 5.
and 5.
1, 3, and 5.
Yes.
Have a couple other different ones here. All right, let's see what our answer is. So yes, Miss C or Mr. C, sorry, stable angina. So right, stable, good go. Miss S has heart disease and dementia. There's, not really anything we're concerned about there. And then Mr. L with shortness of breath and chronic emphysema. Okay, the key word is chronic emphysema. Shortness of breath is expected, right? Patients that have chronic emphysema, we expect them to have, some shortness of breath. So good job. Good job. All right. A client admitted with chest pain insists on leaving the hospital immediately before treatment is complete. Which actions should the LPN take? Select all that apply. So, one, prevent the client from leaving. Two, call the family to let them know of the client's intent to leave. Document the client's intent to leave AMA. Reinforce the risks involved to leave before treatment is complete. And five, have the client sign a form relinquishing facility responsibility. I almost said family responsibility.
3, 4,
So,
and 5.
Yep, 3, 4, and 5.
very good. Can we prevent them from leaving?
No.
No.
What is that considered?
Is that kidnapping?
Restraint.
Or
Kidnapping.
holding on?
Absolutely. If they want to leave, then they have every right to leave as long as we do our due diligence, right? Tell them that, hey, it's not safe for you to leave. This is what could happen. Da 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 da. We want to document it and we want to have them sign a form that says they are not going, that we're not responsible, that they are making this decision of their own free will. All right. The nurse describes the procedure if a fire breaks out in a client's trash can, which is correct. Select all that apply. So one, first, pull the alarm as the first step. Two, use only a Class C fire extinguisher. Three, have ambulatory clients evacuate to a safe place. Four, pull the pin on the fire extinguisher before use. Or five, close all doors.
1, 3, 4, 5.
Okay. All right, let's do this. All right, so procedure for a fire. It, sorry. Remember race and pass. I always forget that. So race is rescue, alarm, confine, extinguish. So the first thing we do is rescue. All right. So we're going to get all those ambulatory patients to a safe place. All right. Then after rescue, then we pull the alarm. Okay. Then so close the doors would also be kind of confining. So you want to close the door, pull the pin before use. All right. So PASS, pull, aim, squeeze, sweep. Okay. So you pull the pin, you um sorry, like wow, you pull the pin, you aim it out to where the fire is, you squeeze the little handle on the extinguisher, and you sweep at the base of the fire. Oops, there we go. All right. Which clients are best assigned to the LPN? Select all that apply. So we have a 30-year-old man with active GI bleeding that requires multiple blood transfusions. We have a 78-year-old female with osteoporosis who needs assistance performing range of motion exercises. We have a 29-year-old male who is 6 days post-op from a colostomy and is on a clear liquid diet. Or we have a 55-year-old male who reports chest pain and has ST segment elevation on his EKG. Which are those are we going to assign to the LPN?
2 and 3.
Okay.
Yeah.
All
2 and
right.
3.
All right. Absolutely. Right. Female or 70-year-old female with osteoporosis who needs assistance with range of motion, right? Very stable. Your 29-year-old who's 6 days post-op he's on a clear liquid diet, stable, doesn't say that there's any issues there. Your 30-year-old with an active GI bleed that requires blood transfusions, right? That's going to need to be done by the RN. And that 55-year-old male who has chest pain and ST segment elevation on his EKG is going to need that RN. Good job. All right. The nurse is supervising an unlicensed assisted personnel performing mouth care on an unconscious client. The nurse would intervene if the nurse noted the UAP performing which actions. Select all that apply. So one, turning the client's head to one side. Two, placing the client in a flat supine position. Three, using small volumes of fluid to rinse the mouth. Four, using a gloved finger to open the client's mouth. Or five, placing an emesis basin under the client's mouth. At what point would we need to intervene?
2 and 3.
Okay, got 2 and 3.
I know 2. I don't
2
know.
and 4.
Got 2 and 4. Okay.
I think it's just 2, but I don't know.
All right, let's see. So when are we going to intervene? So one, placing them in that flat supine position, right? If we're going to do oral care, we're going to be putting fluids or any kind of anything in a client's mouth. If they're laying flat on their back and they're unconscious, that's a concern. Definitely don't want to open a mouth, right, with your fingers. Okay. What can happen, right? Just as they're unconscious doesn't mean that they're in a coma, right? They're just unconscious. What
So
can
how
happen
would you
if you
get their mouth open? I mean,
use the toothette?
oh.
And why
Yeah.
wouldn't it be 3 small volumes? They're at risk of aspirating.
You're using
Right,
a
but if we
small.
have their head to the side or we have them in a side lying position, then they're less likely to aspirate. And we're only going to use a small amount of fluid to wipe their mouth. Most of the time, if they're unconscious, what are we going to use? We're going to use those little pink toothette things, right? The little spongy
This
ones.
is why I'm
It's
confused with the
moisten, but you don't
volume.
use a
I've only
small
ever used those, and you
water.
kind
You
of
just
do it in
moisten the
water.
toothette.
Say
Which
that again, Jimmy. I'm sorry. Somebody's got some feedback.
I
Say
said
that
I've
again.
only ever used the swabs that you're referring to, which you kind of just drench those in water. But other than that, like small volumes of fluid would kind
Yeah.
of trip me up because that's insinuating you're putting a good amount of liquid in a unconscious patient mouth.
Yeah, and you're not supposed to.
Right. No, they're saying small. So that's exactly what it is. You know, those little, like you said, you use those little pink toothets. They only are going to hold a small amount of fluid. It's still got fluid on it, right? But it's not pouring fluids into their mouth. They also have some that come like pre-filled that you can use as well. So we're still putting fluid and we still have to put fluid in their mouth because we're cleaning their mouth. But if we're not using a toothette and we're using like a toothbrush or something like that, we still would have to rinse their mouth.
And
So it
put
is
on the side.
small. Just think, I mean, that's the key word. It's small. It's not like we're pouring water into their mouth. We're just using a small amount. All right, last question for this one. The LPN is prioritizing care assignments while supervising a UAP. Which tasks should the LPN delegate to the UAP to allow the LPN to focus on higher priority clients? So one, transport a stable client to radiology, provide oral care for a stable client, assess a client with a new fever of 102 degrees, collect a urine specimen from a client with a urinary catheter, assist a stable client with toileting, or evaluate lung sounds for a client with pneumonia.
I think they might do A, B, D, and E because they don't do C or F.
Yeah, A, B,
D.
D, and E.
Okay. All right. Absolutely. So transport that stable client, provide the oral care for a stable client, collect a urine specimen, assist a stable client with toileting. They cannot assess, they cannot evaluate. Awesome. You guys did awesome. I'm so proud of you guys. Awesome, awesome, awesome. All right. These are going to
For
be next gen questions, okay? Questions I couldn't put in a PowerPoint. So there's like drop down and other types of questions. So we are going to go through these. Um, Katrina, can you mute Katrina?
I'm sorry.
It's okay. So these are going to be, there's some of them are going to be like drop downs, and some other ones. So let me share my screen. We'll go through all of them together. Oops. Okay. So this first question, the scenario says the nurse is reinforcing patient education for a patient on how to use a peak flow meter. All right. So select from the options provided to place the steps in the correct order for how to use the peak flow meter. Okay, so let's read the steps first. So we have the patient records the value and resets the pointer, rest for a few breaths. The nurse instructs the patient to set the pointer to 0, take a deep breath while standing, make a firm seal with the lips around the mouthpiece, and then blow fast and hard. And then rest, repeat the process for a total of 3 readings. Okay. So what is the first step in using a peak flow
So
meter?
the first thing you would want to do is make sure you instruct the patient to set the pointer to 0.
Okay. Set the pointer to 0. That will be first. Okay. What do we do after that?
Take a deep breath.
Okay. Then we're going to take a deep breath while standing. Okay. What's after the deep breath?
Make
Make
a firm
firm
seal.
seal. Firm
Okay.
seal with, yeah.
Make a firm seal. Then what?
You're gonna have the patient
Rest.
record their value and reset the pointer.
Okay, so that's fourth.
Rest
Then
for a
for
few
5,
breaths.
yeah, rest. And then 6 is repeat the process for a total of 3 readings. Let's see if
All
that's it.
right, good job. What did we mess up? Do. So first was the seal. Second was take a deep breath. Third, what did we put as
How
third?
you gonna make a seal and then take a deep breath?
Oh, I see what it says. Okay, so here it says first, make a firm seal with lips around the mouthpiece and then blow fast and hard. Then it says take a deep breath while standing. Then it says record the value and reset the pointer. Rest for a few breaths. You know what though? Let's see. Where's my evolve? What's the name of that book? Clinical skills, right? Because I'm like, why would they put their mouth around the mouthpiece before they
They breathe.
took a deep breath? So let's look what the book says. That's always the best
When
way to
we
do
do
it.
it at work, you have to secure the lock before you take the deep breath.
For a peak flow meter?
Yeah, when you blow it. I think those are the instructions. The other one I don't know. But you put it on your mouth before you blow. That's what you're saying, right?
Yeah.
Yeah.
It doesn't have peak flow meter in there. All right, we'll go with that. All right. We have a 62-year-old patient who's having dysrhythmias after a myocardial infarction 1 week ago. Vital signs are stable, and the patient is alert and oriented. For each potential healthcare provider order, indicate whether it is essential, non-essential, or contraindicated. So, would 24-hour telemetry be essential, non-essential, or contraindicated?
Essential.
Okay. Monitor vital signs every 2 hours.
Essential.
Everybody say essential.
I would say non-essential. Yeah, non-essential.
Non-essential. Essential, non-essential. All right. Insert a urinary catheter.
Essential.
Non-essential? No, yeah.
I say non, yeah.
Contraindicated.
All right. I'm reading the chat as I'm listening to you guys too. All right. Insert an IV catheter saline lock. Es-
Non-essential?
Non-essential. Okay. Place the patient on intake and output.
Essential.
Essential.
Monitor and chart daily weights.
Essential.
Essential.
Bed rest.
Essential.
Essential.
Hmm.
Administer morphine 10 milligrams IV for complaints of chest pain.
Essential.
Essential. These questions stress me out. I agree. I would get stressed out too. And a DASH diet.
Yes.
All right, here we go. All right. So 24-hour telemetry is essential. Absolutely. Monitor vital signs is non-essential. We're not going to wake him up every 2 hours to get his vital signs. All right. We've got him on the telemetry so we can monitor his heart rate. And that's just going to prevent him from getting rest. Inserting a urinary catheter is contraindicated. He doesn't say he has any urinary issues. And that just increases the risk for infection. We're going to do an IV. We're going to place them on INOs. We're going to monitor and chart daily weights. We do not want to put him on bed rest, right? We don't like putting people on bed rest unless we absolutely have to, right? We need to get them up and moving around, prevent muscle atrophy, pressure areas, pneumonias. Morphine 10 milligrams IV for complaints of chest pain is contraindicated. Okay. What's a normal dose of morphine?
Like 0.5?
0.5. Well, that might be a little bit low. But It's usually like 10 to 20 milligrams, but we're not going to give them initially 10 or 20 milligrams. It's usually going to be smaller, right? Especially look at his age, he's 62. We always start small, right? And go up from there. Okay. And then the DASH diet, of course, that's going to be essential, right? What is the DASH diet?
A
Low
healthy heart diet.
sodium.
A heart healthy diet, absolutely, right? So, um, that's absolutely right. If he's already had a heart attack, it's the DASH stands for the dietary approaches to stop hypertension. Okay. All right. All right. So complete the sentences by choosing the most probable option for the omitted information from the list of options provided. So pulmonary edema is caused by right or left-sided heart failure.
Left.
Left.
Okay. Nursing priority interventions for acute pulmonary edema includes placing the patient in a semi-Fowler's tripod, reverse Trendelenburger, high Fowler's position.
Tripod position.
High Fowler's. Administering oxygen to keep the oxygen saturation between 89 to 90, 98 to 100, 93 to 95.
98 to 100.
93 to
93 to 95. Administer what for diuresis?
Furosemide.
Yeah.
Furosemide. Nope, you said it right. Good job. Blank is the best indicator of fluid increase.
Weight gain.
Sensei, y'all better get this one right. We just talked about it. All right. Good job. Absolutely. Pulmonary edema is caused by left-sided heart failure. Priority interventions for acute pulmonary edema, placing them in a high Fowler's, giving oxygen to keep the O2 sats between 93 and 95, give furosemide for diuresis, and weight gain is the best indicator of fluid increase or even sometimes fluid loss, right? All right. So this one's a delegation. So the nurse and AP are assigned to care for a patient who's been unresponsive for several weeks after a drug overdose. The patient is breathing and displays purposeful withdrawal from painful stimuli and occasional incomprehensible sounds. So which task can we delegate to the AP? Okay. Can they take and record vital signs every 4 hours?
Yes.
Okay. Can they thoroughly clean and dry the peri area after episodes of incontinence?
Yes.
Can they talk to the patient and explain actions as care is given?
Yes.
Okay. Can they give tube feedings and report problems?
No.
Okay. Can they carefully check skin and document findings?
No.
Can they perform mouth care every 2 hours with spongy swabs or sponge swabs?
Yes.
Sorry,
Yes.
I said spongy. Can they perform passive range of motion?
Yes.
No.
Yes.
Yes, they can.
Yes. Okay.
Yes.
Can they assess respiratory effort and listen to breath sounds?
No.
No.
Can they reposition the patient every 2 hours?
Yes.
Oh, why did I click that? Sorry. All right. Did I click everything right now that it just did that? Okay. All right. Correct. Absolutely. They can record vital signs. They can change them. They need to talk to them, right? We hear those stories about people waking up after being in comas, right? Or even being unconscious. And what do they say? They heard everything that went on in the room, right? So even if your patient is in a coma, they're unconscious, you don't just go in there and start performing tasks. You always talk to your patients and tell them what they're doing. All right, this one's a case study. So the nurse is providing care for a 79-year-old patient who has dementia and is unable to perform self-care. He is incontinent and wears adult diapers. I hate that term, but okay. His medical history includes cataract surgery and hypotension. He is unable to feed himself and has a poor appetite and has lost 10 pounds over the past month. The AP checks his diaper every hour and changes it as needed. He is repositioned every 2 hours using a pull or draw sheet. The healthcare provider is planning to insert a feeding tube. Select to highlight the factors in this case study that increase the patient's risk for developing a pressure injury. Okay, so the nurse is providing care for a 79-year-old patient. Do we need to
Yeah.
highlight 79-year-old patient?
No.
Okay, who has dementia,
No.
unable to perform self-care.
Yes.
Yeah.
Okay, he is incontinent
Yes.
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 and wears adult briefs because I don't like that term.
Yes.
His medical history includes, does cataract surgery make a difference?
Mm-mm.
Hypotension make a difference for pressure
No.
areas?
Yes.
Yes. Okay.
No.
He is unable to feed himself. Does
No.
that increase his risk for pressure areas?
Yes,
No.
because it's not getting the nutrients that he needs.
That's not what it's
Like,
asking.
I say no.
No.
He's unable to
No.
feed
No, it's
himself. That
not.
doesn't, okay. He has a poor appetite,
Yes.
Yes.
okay, and has lost 10 pounds
Yes.
Yes.
over the past month. All right. So I know exactly what you're saying about the unable to feed himself, but that inability to feed himself, does that make a difference with pressure areas?
Mm-mm.
Me not being able, okay. Still incorrect. What did we miss? Dementia. Why is dementia a risk factor here for pressure areas? Why is dementia a risk factor for pressure areas?
They'll forget to move or something. I'm confused.
Absolutely, they forget to move and they may not recognize, right, some of those like clues, right? Like I've been sitting in this chair since my class started at 2 o'clock. Okay, I had a class right before your class. Okay, if I didn't move around in this chair, probably would have a stage one, right? But they may not recognize those cues as a result of that dementia. Or, yeah, they don't want to move, right? Absolutely. So, all of those. But yes, dementia is considered a risk factor for the development of pressure areas. All right. The nurse is assigned to care for patients at risk for pressure areas. Here's another one. Prioritize the order in which these patients could be seen by the nurse in order to ensure safe and effective patient care. So we're going to select the order the patient should be assessed. So one, we have an 84-year-old with an open wound, deep crater on the sacrum with areas of granulation tissue when dressing was last changed. Vital signs, temperature 98.8, pulse 84, respiratory 18, blood pressure 128/76, alert and oriented, watching TV. Next, we have a 72-year-old with a new reddened area on the right hip that does not blanch with finger pressure. Vital signs 99.2, pulse 80, respiratory rate 18, blood pressure 142/80, drowsy and napping. Third one, we have a 78-year-old with a pink wound that is moist with a ruptured blister on the left heel. Vital signs, temperature 102.8, pulse 110, irregular, blood pressure 108/60, and confused. And the last one, we have a 66-year-old who is obese with the sacral region wounds reddened, warm, and hard. Vital signs 97.6, 92, respiratory rate 24, blood pressure 164/92, requesting PRN pain medication. Who out of those four are our highest priority first? Who are we going to go see first?
C,
C.
C first.
Okay.
Then B.
And then B, you said?
Yeah.
Okay.
D.
D, and then A.
And then A.
I was
Awesome. You guys, that was awesome. Good job. Right. The first one, why? Because we have that elevated temperature, right? And they're confused. They have an elevated heart rate as well. So they may have an infection. Awesome job. Awesome job. You guys are awesome. All right. Ooh, what is this one? The nurse is to administer subcutaneous regular insulin to a diabetic patient who is on sliding scale regular insulin and whose finger stick blood glucose is 210 milligrams per deciliter. The injection site is the abdomen. Select each item that applies to the implementation of administering a subcutaneous insulin injection for this client. So you're going to give a sub-Q insulin injection. Do you check the medication order?
Yes.
Okay. Do you perform hand hygiene?
Yes.
Yes.
Do you identify the patient using at least 3 identifiers?
No, you only need 2, right?
Okay. Prepare the
You didn't
insulin.
hit hand hygiene.
Oh, thank you. Prepare insulin by drawing up into syringe.
Yes.
Okay. Put on sterile gloves.
No.
Okay. Select site for injection and cleanse with alcohol swab using a circular motion.
Yes.
Yes.
Okay. Hold syringe barrel at 30-degree angle.
No.
Okay.
Yeah.
Support skin at injection site by bunching tissue between thumb and index finger.
Yes.
Yes.
Press plunger to inject insulin using smooth motion.
Yes.
Okay. Remove needle and activate needle guard.
Yes.
Yes.
I had to read that twice. Wipe injection site with alcohol swab to remove any blood.
Yes.
No.
No, you wipe. I
Uh,
thought you wipe it with the gauze to remove blood, right?
Okay.
That's a no.
Place needle and syringe in Sharps container.
Yes.
Yes.
All right.
I got a quick question before we hit
Yes, ma'am.
correct.
Sure.
The one where it say how we bunch the skin. I thought for insulin like we spread the skin, but maybe it's the same. Maybe it's just the word and I'm overthinking it. It's okay.
Nope, you're backwards.
Okay.
Insulin is subcutaneous. Subcutaneous, we pinch.
Okay.
Muscular, IM, we spread.
Okay. Okay.
Okay.
Mm-hmm.
All right, here we go. We're hitting submit. Oh, what did we do? Check the meta order. We performed hand hygiene. We prepared. We selected the site. We support the skin. We press the wood. What did we not get? All right, let's go back. We got the med. We got the hand hygiene. Got the med. Got the hand hygiene. Prepare insulin.
It's
Prepare
probably the
insulin.
identifying part.
No, because that's not. And then no sterile gloves. Select site. Select site. Okay. Support skin. Support skin. Oh, we didn't do wipe with alcohol to remove any blood.
But I thought you do it with a
Yeah, we
gauze.
never
You
told her.
only do the alcohol in the beginning. You don't wipe alcohol. It's an open area.
Yeah, that's a good one. And it doesn't have it doesn't show me the rationale. Yeah, I wouldn't use alcohol either to remove blood, just like if I was doing a glucose stick, right? Clean with alcohol, let the alcohol dry, do the stick, and then I would use gauze to collect any, extra blood. You know what? I want to write this one down. Does it have a number? It doesn't.
question 9.
Yeah, this is kind of like doing Saunders questions. So here it is. ID 0719. Okay. All right, I'm gonna write that down because I'm gonna check with that. I'm not sure. I wouldn't do that either, honestly. So, and I do insulin injections all the time. All right, this is probably the last one. All right. A female client who has type 1 diabetes mellitus for many years is having difficulty keeping her hemoglobin A1C less than 77%. 77%? Did I read that right? Or does that say 7.7? No, it says 77. We're skipping that question. All right. The nurse works in a clinic that primarily serves older adults who have a variety of chronic health problems. While assessing patients, the nurse is vigilant for evidence of elder abuse, which is divided into 6 categories: physical abuse, psychological or emotional abuse, sexual abuse, neglect, abandonment, and exploitation. The nurse will use the guidelines for documenting a sign or symptom. Which type of elder abuse is depicted in each of the patient's situations? Note that all responses will be used and may be used more than once. All right, let's move this down a little bit. All right. I have bruises on my face, a black eye, and welts on my upper arms because I fell down the stairs. Physical, psychological, sexual, neglect.
Physical.
I gave my oldest son money every week because he can't seem to get out of debt.
Finance. No, they ain't no more.
Exploitation.
Exploitation. I asked my daughter to go grocery shopping for me, but she hasn't gone for several weeks.
Neglect.
Neglect.
What that?
Abandonment.
Wow.
Which one? Big one, big one, big one. All right, abandonment. Um, my caregiver makes fun of me when I leak urine, so I try to clean myself.
Emotion.
The psychological.
Psychological, emotion.
Okay.
Boom.
My lip got bruised when my caregiver was feeding me something I don't like to eat.
Physical.
Physical.
My daughter won't talk to me. She treats me like I'm not even there.
Emotional.
Abandonment. Or
Physical, psychological, emotional.
Okay. My husband gives me some water before he goes to work. My husband gives me some water before he goes to work, so I don't drink that much. I'm sorry, it doesn't say so. My husband gives me some water before he goes to work. I don't drink that much.
Neglect.
It's a neglect.
I mean, but
Neglect.
she choosing that.
That's a good one. I don't have a preference for this
It's
one.
neglect.
Neglect. All
Mm.
right. I don't like it when he does it to me, but he says that all people enjoy being touched.
Sexual.
Sexual.
Sexual, yeah.
She left me at the bus station and gave me some money for a ticket.
Abandonment.
Neglect. Oh, abandonment.
That's
Abandonment.
bad. Like, I don't even want to read them. All right, what did I mess up? Because that was probably me. So bruises was physical. Exploitation was giving the son money. I
Neglect.
asked, is that that's the one we missed right there. So I did abandonment. So
And there was neglect.
instead of neglect, emotional abuse, physical, psychological, neglect, sexual abandonment. All right, guys, awesome job. You guys rock. You're going to rock this. You're going to rock your HESI. I just have so much faith in you that you are going to go knock your HESIs out of the park.
I hope so.